So the question is, how are the healthcare systems doing it? Well, we've already kind of identified let's say they have 30,000 and maybe they're getting a couple thousand doses, right? So they're going to comb through what's called the electronic health record, and based on the diagnoses that are most associated with high mortality and morbidity rates from COVID, in addition to age, are putting those together and pulling through their most at-risk individuals. So Oak Street, by nature of the fact that its primary business is over 65, they're doing their method a little bit different because they have 65-year-olds who are continually coming in. The hospitals are having to pull through. If you think about the healthcare systems, and they're not just hospitals, I should say healthcare systems, are combing through those records and then pulling individuals in. So again, it really is based on that kind of comorbidity in addition to age. And I know that that's hard because you think, I understand, I hear the word unfair a lot. I see that, it's not fair, I should get it first, how come they're getting it first? And it really has to do with that weighting of those factors. We also know that in the age 65 and above, they may seek care from all three systems, right? So they're not always restricted by health insurance plan if they have Medicare. And so again, they may be called by one system ahead of the other, depending upon where they are in their process. So I come back, take the first available dose. Don't make judgment about someone else who's getting the vaccine because you may not know all of their medical history, right? Because this is generated by their electronic health record, not by positive responses to questions. This is generated by diagnostic codes that are put in when you go in to see your healthcare providers. And the third is to understand that everybody is working towards. So even within a household, one of the spouses may get it ahead of the other. And, and then I also want to be clear that places like Walgreens, right, or the pharmacies, their systems are entirely different. So I know people say, how do I hedge my bets, right? We're coming up on Super Bowl, right? I don't register at Walgreens, register at Myers, register online at, Winnebago County Health Department, and wait for your provider to call. And take the first one that calls you. They're all using the same vaccine products. Not one is better than the other. And I know that that's hard because, again, without some of that discussion, without a statewide system or a nationwide system, there are multiple registration systems. And we're not bothered by the fact that you register at multiple locations. We will not be hurt that you didn't come to Winnebago County Health Department, that instead you went to Walgreens or your healthcare provider. We're going to be happy that you got vaccinated.
And touching on that registration, will you guys help filter into the healthcare systems, or is that two different problems?
The question is, are we going to filter into healthcare systems? We will not be filtering into the healthcare systems because they're going to use their electronic health records, which have the complete diagnosis. Remember, it's self-attestation, meaning we ask people to respond positively. We do not confirm diagnoses. So if you put on our system that you had heart disease, we believe that to be true and honest. Whereas in the healthcare systems, you'll actually have what's called an ICD-10 code associated with that diagnosis of heart disease.
And then you touched on that pharmacy portion. Is the health department involved in that at all with dispersing the vaccines to local pharmacies?
The question is, are we involved with disbursement to local pharmacies? Not at this time. The state is working through some of those plans. We don't know where that's at, but as of today, we are not involved with disbursement of vaccine to the pharmacy partners.
Dr. Rosell, does it just come down to there's just not enough doses right now to meet the demand?
The question is does it come down to there are not enough doses? That's a huge part of the problem, right? But even if we had, let's say we had one dose for everyone who wanted it today, we still have to get systems so that we can actually get people vaccinated. I can tell you that people tend not to like to be vaccinated after certain hours, on certain days of the week. We find that, it's not convenient. But even if that were the case, there probably would be some other points that people would not. People travel. We've heard some people want to get their vaccine, and should they come back for their second dose if they're a snowbird and they're traveling to Florida or Nevada or someplace else. And again, I come back to, this is really a very different time. If we thought a pandemic was convenient or fair, I want to remind people it has not been fair, and it certainly has not been convenient for any of us.
Are there any plans to have a mass vaccination facility here in our region?
The question is, are we looking at mass vaccination? Of course, that's one of the opportunities with the state that we have obviously asked for resource. We are one of the state community-based testing sites. But again, they have to look at all of the allocations throughout the entire state. And of course, we advocate for wherever we can. But I want to come back to, we want to make sure that we're still applying that phased approach in an equity lens, that those who most at risk have an opportunity to be vaccinated first.